but I would just like to go ahead and say hello, everyone. My name is Megan Carter. I am ESIP's Community Director, and I want to say welcome to this webinar in the Earth Science Information Part Putting Data to Work webinar series. This follows ESIP's 2020 theme of putting data to work, building public-private partnerships to increase resilience and enhance the socioeconomic value of this webinar to move beyond data discovery to explore how the Earth community is data to work using data in new and creative applications, creating derived and showcasing examples of data integration in order to enhance the results and enhance economic data. In addition to playing on the doubling of work, this series highlights public partnerships as we explore data usage increases the value of science research to other economic sectors. Just a couple of quick things about ESIP. There are a few who haven't heard. Vision is to be in promoting collection, stewardship, reuse, and use of earth science data, information, and knowledge, and to be responsive to societal needs. So for more than 20 years now, ESIP has helped members of the earth science data community to find each other across traditional boundaries and to work together, thereby leveraging each other's expertise and working together on common data challenges and opportunities. What ESIP does is foster rich collaborative experiences, including numerous community-driven virtual collaborations, the ESIP Lab, which supports the development of innovative applied earth science technologies, and 2 annual conferences. And you can see on the right here that our next meeting will be in January. It'll be a virtual meeting, and the theme will be Leading Innovation in Earth Science Data Frontiers. And you can expect to see a call for sessions come out later this week. So much of the virtual collaboration that I just spoke of happens through approximately 30 themed collaboration areas, which are groups of people that convene virtually regularly around earth science data related challenges or opportunities. And we'd like you to be aware of these opportunities because they're a great place to jump in and get involved. If you see one of these meetings happening on the ESIP Telecon calendar, you're welcome to hop on and say hello, no need to RSVP. So now getting to the most exciting part of today, I'd like to introduce our speaker, Este Geraghty. Dr. Geraghty is the Chief Medical Officer and Health Solutions Director at Esri, where she leads business development for the health and human services sector. Formerly the Deputy Director of the Center for Health Statistics and Informatics with the California Department of Public Health, Dr. Geraghty led the state vital records and public health informatics programs. There she engaged in statewide initiatives in meaningful use, health information exchange, open data, and interoperability. While serving as an associate professor of clinical internal medicine at the University of California at Davis, she conducted research on geographic approaches to influencing health policy and advancing community development programs. A specific area of research focus involved pesticide safety. In addition to her degrees in medicine, medical informatics, and public health, Dr. Geraghty is also a board-certified public health professional and a geographic information systems professional. We are very delighted to welcome Este here today, and I will now pass the screen share to her, and I will let the participants here today know that we will have time for questions at the end of the presentation, but if you have questions along the way, I welcome you to type them into the chat box. Welcome, Este.
Thanks, Megan. I appreciate that. Can I make sure that you are seeing my screen?
Yes, it looks great.
Fantastic. All right. Well, hello, everyone. I'm really happy to be here. I hope you're all safe and healthy. And I think this is a great opportunity today to talk about putting spatial data to work, and there's been a lot of it for COVID-19 response and recovery. And so the way that I thought I would approach this presentation is to provide a few introductory comments. If there's anybody who doesn't know a lot about GIS and geography, I'm guessing you guys probably know quite a bit, so I'll keep that limited. Then I want to talk about an overall approach to using geographic information systems for this pandemic. And from that approach, I'm just going to fit in the different examples and use cases and how data really was put to work to solve some of the challenges that we have faced and continue to face going forward. So I'll start with what we all know, right? I don't have to tell you this. We are definitely living in challenging times. Our world is in trouble in many ways. We have crises that are overlapping, whether we're talking about the locust plague or climate change. We have massive unemployment and obviously the topic of the day, a global pandemic. All of these threats really create a sense of uncertainty in the world. And in many ways, they're all interconnected. It becomes really complex. How do we figure out what to do, how to make sense of it, how to make progress in addressing all of these threats? Well, there are a few strategies that I think are we're going to need better understanding of the problems and their root causes. We're going to need better and more frequent and more reliable communication methods. And we need technology environments that can support stronger levels of collaboration among internally and between different departments and organizations. Now, it turns out that geography, this science of our world, really does offer a great opportunity to organize and integrate our knowledge and interconnect our experts across so many important disciplines to develop some of the answers that we need. One of my favorite things about geography is its ability to really bring together all kinds of data and analytics, connecting them through that common location information. It is truly remarkable what we can learn and understand when we analyze and visualize our challenges in context. I'm sure I'm preaching to the choir on this one, but it does allow us to really take intelligent and informed actions. And this is another way to look at how we apply geography to important problems. I personally like to call this the workflow model, because it really tells the story to me that a GIS technology system provides this framework and process for supporting every step in a workflow. That can be from measuring and gathering data to doing some visualization and mapping. And that step actually inspires hypothesis development through pattern recognition. So from there, you start to dive deeper, right? You want to use those tools that can do analytics, modeling, prediction. And as you develop understanding about whatever challenge you're addressing, interventions can start to be planned and designed. So from there, you want to take it to the decision-making process. How are you going to prioritize all of those interventions and ideas and the efforts and the workforce needed, and target all of those things in a very strategic way to take informed action that makes a difference, and then evaluate your outcomes and results. So what I like about this is it's a process that we can go through for any kind of challenge, and there are GIS tools that can support every part of that process. But you guys, and this is all about data, I'm sure you probably love data as much as I do. And almost every project, every workflow starts with, well, what's the available data? How does it come? What format? And so I just wanted to make sure that I point out that a GIS system is capable of reading in all kinds of data. It's really important to those efforts that I mentioned to integrate our collective knowledge in useful ways, right? Because different kinds of experts are using different data. You guys are experts in Earth observation data. I'm going to mention to you that a lot of health data is really in tabular format, and that's where I have more expertise. So as we dive into this topic of COVID-19 and health, I think you'll find the vast majority of that data is probably more tabular in nature. Real-time data has also become quite important in health lately. But toward the end of the presentation, I'm going to show you some uses for voxels and 3D data that I think you'll find particularly interesting. So all of that data, no matter where it comes from, is fed into this comprehensive and integrated system. And with COVID-19, what we've been seeing is that organizations often start with their GIS support team. And that team facilitates some of the key mission areas for the organization. It could be things like disease surveillance, their planning and their logistics, or if they have people out in the field, making sure that those operations go smoothly. They're looking at ways to support executive awareness and the management procedures so that evidence-based decisions can be made. And of course, particularly in these times, it's more important than ever to engage the community. And I would just say that in a long-term and complicated situation like this pandemic, it's so important to ensure that everyone is using the same authoritative data resources and that everyone can collaborate and work together, again, across and between organizations. And I think technology of different kinds can really support that notion of using authoritative data and communicating and collaborating effectively. Now, since you are, as I understand it, all familiar very much with mapping and GIS and you understand its value, I simply want to note that a number of the key GIS capabilities that you're all familiar with were really effectively put to work for COVID-19. From, again, mapping and visualization efforts that put data into context to dashboards, creating situational awareness. We also saw great uses of analysis and data science to understand things like disease spread and resource allocation, while also monitoring our intervention performance. And when there wasn't already an existing data resource, organizations were able to use mobile collection tools to quickly gather that important information. Now, from the very beginning, we shared with GIS users an approach for COVID-19 response that we believed helped them, GIS users actually around the world, to be more successful with their efforts. And the approach began with mapping the cases, and then looking at the spatial and temporal spread of disease. From there, we suggested mapping population vulnerabilities and infrastructure capacity for addressing the challenges of the pandemic, while all the time remembering to communicate in clear and transparent ways with maps. And people did actually do these things with great success, and I will be showing you those things. But then we extended the approach for some of the reopening efforts to include things like mapping overall disease trends, more than just the current situational awareness. We wanted to look at the long-term trends. We wanted to help organizations map community and organizational resilience, and that's such a broad category. We're going to spend a fair amount of time on that. And then between those two things, there was monitoring a balance between trends and resilience, and that really had to do with mapping the overall impacts so that really a delicate balance could be maintained in the long run as reopening plans and phases were considered. So from here, I'm going to spend the rest of this presentation showing you specific examples that refer to all of these different pieces of the approach. So mapping the cases, I would be remiss if I said it began anywhere other than at Johns Hopkins University with their COVID-19 dashboard. I can't imagine that there's hardly anybody who hasn't seen this dashboard since it came out in late January. And it really has a special place in history for several reasons, but it is literally the most viral GIS application that the world has ever seen. It has been requested hundreds of billions, with a B, hundreds of billions of times over the last 8 months. But it's much more than a well-designed map-based data-driven dashboard, which is enough, but it's more than that. Its creators really began their efforts with a mindset about data, right? They had an emphasis on sharing the data with anybody, right? Whatever they collected, they wanted it to be open. And because they did that, they ultimately influenced hundreds of governments around the world to build their own dashboards and track things at their local level. Now, the data here is updated multiple times per day, and that's another innovation, actually, because we've never really seen this at a broad level with health data. Near real-time updates. This really built an expectation for real-time information about almost everything COVID related. I mean, just look to the news and the questions that people ask. They want the data now. And I think Johns Hopkins inspired that expectation. It's also really opened the eyes of health organizations to the value of map-based information. And just a few examples here, the dashboard has been seen as a backdrop in operations centers around the world, from US Health and Human Services Secretary's Operations Center to emergency response meetings with leadership in Germany. We saw it in Italy. It was, if you can see in the back, that's still a backdrop for the news in Ireland. So when it came to mapping the cases, many did it, but Johns Hopkins University really set the trend with their COVID-19 dashboard. So the next part of the approach is mapping the spatial and temporal spread of disease. And I've really always liked this visualization from the University of Virginia's Biocomplexity Institute. Now across the top, as you can see, there's a time slider so that you can really review day to day the cases or other indicators. They have several of them across the top from the beginning of the outbreak in the US and around the world to the current day. So I updated this yesterday, so it's showing, or the day before, through September 21st. So interesting visualization there to kind of see the overall spread of disease. Now, when we're talking about health matters and using GIS, we always want to be able to understand if different people who are living in different places are more or less likely to be affected by something. Now, those that are more likely to be affected are vulnerable populations. So with COVID-19, people could be vulnerable for any number of reasons, and we can actually visualize those. So it could be that they're older age adults and have medical comorbidities that make them more susceptible to severe disease. People could also be vulnerable because they're essential workers and maybe more likely to be exposed to the virus. And I have to tell you guys, I've been talking a lot lately, so I'm going to take some frequent drinks so I don't lose my voice. Hopefully that'll keep me from coughing. But there's other kinds of vulnerability as well. So maybe the vulnerability is because they live in congregate housing situations like nursing homes, university dormitories, or prisons. The thing is, we can overlay various vulnerabilities to find the highest risk places for COVID-19 in consideration of all of the types of risk factors that people can exhibit. And I'm going to show you in a few minutes how you can put this kind of data into action very soon. But right now, I wanted to discuss some of the analytics involved in mapping capacity. So this is about your infrastructure and how well you're able to respond to an event like this that would cause you to surge, right, to build up your resources and maybe overextend your resources. So in this case, the whole focus is on forecasting models that could take hospital bed utilization data along with social distancing behaviors to predict whether bed utilization is going to be overextended. So hospital capacity could have problems. Every hospital and government wanted to predict if their curve would stay flat, maintaining the health system's ability to care for each and every person that comes through their doors, or if some hospitals may be overwhelmed and exceed their capacity to provide optimal care for their patients. Now, I know you guys are scientists. This is a scientific group, right? So you know that no model is perfect, but some models are useful. We rely on that. In this case, a number of models came out to do that hospital bed capacity forecasting. And I would say that some savvy organizations use tools like what I'm showing here is ArcGIS Insights to compare different models side by side. So in this way, it became really easy to see models that maybe were more optimistic against ones that were more pessimistic. But the whole idea was that it gave decision makers a better sense of the range of potential outcomes as they developed their surge plans. And as just another example here, there was a lot of interest, continues to be interest in death forecasting. And the CDC has been collecting a compendium of death forecast models, and we simply update those in a map-based format so that people can take a look. From the time I captured this screenshot when there were only 9 models, now there are, I think, dozens, quite a few, that can all be compared side by side. But this alone is a big and scientific topic, so I wanted to provide some resources, and I will provide a PDF of my slides after this if anybody would like to get to these resources. But these are a few different ways that you can learn more about COVID-19 capacity forecasting tools. But capacity actually goes beyond just hospital beds. It also includes the availability of personal protective equipment and on, but this is just another example to help you think broadly about the capacity needs. So in this case, to support hospitals being able to report to the federal government, as well as internally understanding their own capacity, we developed a Survey 123 data collection tool. You're seeing that on the left, and then 2 dashboards. The first one is really reporting on beds and cases of COVID-19 on a daily basis so that you can keep tabs on what's going on, how full your hospital is, and how much of that is due to COVID-19. The second dashboard is capturing the critical supply inventory. So all of that PPE that's needed to support the care of infected patients. So monitoring this information, I think you can imagine, is really critical, especially in concert with whatever the current trends are in terms of case numbers, and that forecasting to maintain a sense of readiness for increased case counts whenever that may become a possibility or a probability. Now, through everything, we saw organizations use mapping to better communicate with their targeted populations or the populations in their jurisdictions. Now, dashboards like the one from Baton Rouge, Louisiana that you see in the upper left offered not only the situational awareness we've talked about, but it had a number of key metrics that could be provided to decision makers so that they could really understand and consider contemplate a large number of data inputs so that they would be able to do what's best for the population that they serve. Now, other dashboards focused on providing greater insight around the pandemic. Like in Finland, they were looking at where the vulnerable populations were, as I described before. There was also an effort to assess and deal with pockets of civil unrest across Europe. And that was especially important where those pockets of unrest overlapped with higher case numbers. And some dashboards looked at how we're doing with regard to contact tracing efforts. Oftentimes we saw dashboards that supported more operational types of decisions, like the patient flow through a hospital. And we saw great explanations of spatiotemporal trends with various cluster maps, and even saw humanitarian organizations showing how they were providing emergency food distribution and supporting better accessibility for testing sites. Now, at this point, we started to see the world move from response and strict quarantines toward staged reopening efforts. And we knew that it was going to be important to map and understand trends. So my colleague, Charlie Fry created this great map-based application. Sorry, I'm not showing it live, but you can get a link to it. It shows county-level trends according to the 5 pandemic phases. So the darker pink colors indicate ever-increasing case numbers, and the green ones would be good. So this particular map was updated as of yesterday, and I think you can see that the country is still in pretty bad shape. A lot of those areas that are green are more rural areas. So if you look at the percentage of the population that's still in a phase of rising case numbers, it's the majority of the US population. I'm afraid the drinks are going to happen more often as we go along, so I don't have a coughing fit. Realizing that decision makers were going to need all of the history of cases over time, so not just that 2-week snapshot. My colleague, John Nelson, built COVID Pulse, and that's an app that makes every county trend easily comparable to every other county trend. So the little lines that you're seeing across the map are called Sparklines. This was a term that was coined by Edward Tufte, that guru of the visual display of quantitative data. And they're a graphic technique that in this case allows side-by-side comparisons without using any axis or words or numbers. It's just the data. So you can compare magnitudes, it's normalized for the population. So just imagine this, what you can actually see with this map. If I were to zoom out and look at the whole country, you can compare and get a sense of what's going on for more than 6 million cases across the US for over 3,000 counties occurring over more than 200 days. I mean, it's really remarkable, the data with a great visualization like John created that you can interpret and understand. So I really love these trend maps. They make the current situation much more clear. And this one, by the way, also has the pop-ups along the bottom so that you can get to that detailed day-to-day information if you wanted to dig deeper. Okay, in the next part of the approach and in consideration of this idea of safely reopening, we've been seeing lots of innovation. And I'm not going to have time to share all of it, obviously. People have been working on this for months, but I am going to show you what I hope you'll find are a few interesting use cases. Now, one staple of geographic problem solving is site selection and the idea of geographic accessibility for places. Our communities may need to provide additional kinds of services, right, during these tough times. In this case, it's things like food availability and assistance or drive-through testing centers. So whether you're standing up those kinds of sites or maybe you need to extend your healthcare sites for treating patients with COVID-19 because your hospital system is overwhelmed. Well, in any of those cases, you could use location allocation to find the best spots. So let's say that you want to determine locations for testing sites. Well, in those cases, you would want to choose candidate options for high throughput. Maybe they're capable of drive-through or pedestrian walk-up to get those tests. If hospitals are overwhelmed, then you're looking to find alternative care locations. And those would have to provide the ability to give overnight care. They should be separate from hospitals, but have access to medical personnel, and they need to be able to be suitably equipped to support this disease. Another kind of place would be a food distribution site. Those might be similar to testing sites because you want people to be able to walk up or drive through, so that ingress and egress should be really clear, really good. So we assign different criteria to the different kinds of sites to help make decisions. And then we get to that part that I was talking about before with mapping and understanding vulnerable populations. Well, the first step in citing a facility, doing this kind of location allocation analysis, is to determine the population demand for the new resources. Now, the idea is you want to create a risk surface for each of these risk types. And you can see that each risk type also has several different indicators under it. And so we're combining all of this together. So we look at things like transmission risk, socioeconomic risk, susceptibility to the disease or severe disease risk, exposure risk, and resource insufficiency risk. In the end, what you'll be able to do is provide a risk ranking over all of the geographies in your area of interest. That could be at a very small level, like block groups or neighborhoods. And by the way, I'll have you notice that I added a link to a specific lesson on how this kind of risk surface development work is done. So again, if anybody wants a PDF of the slides, you'll have access to the link and you can play with that stuff. It gives step-by-step instructions. But you take this risk surface information and then you move on to the calculation of location allocation. So to do that calculation, you need road network data because accessibility is really important. And then your inputs to the model, besides that road network data and your accessibility requirements, you throw in all of that population demand work that you just created, those risk surfaces. And then you need to figure out your supply chain capacity constraints. These are constraints for staffing facilities, right? You only have so many tests or so much budget or so many personnel that can do this work. Maybe you're looking for the top 10 because that's what you can support. So you could constrain the model to only select the top 10 optimal sites from the entire population of your candidate options. But you could also provide an analysis that selects everything that meets your predefined criteria. So that's location allocation, but the utility of mapped information goes beyond that. Once you've made those decisions to move forward with your chosen sites, additional applications could be used to track your progress in standing up the sites and monitoring the ability of each of those sites to meet the ongoing population needs that you calculated. Now, another use case for GIS involves contact tracing, and I want to spend a little bit of time here because it's currently a very important workflow. And because of its importance and my desire to understand it, I actually became a certified contact tracer a couple months ago. And I really wanted to know the ins and outs of this process and make sure that bringing a GIS system into this would add value. So, as you know about contact tracing, we tend to use these traditional contact tracing methods in the very early stages of an outbreak. That's when human-to-human transmission is occurring in a relatively limited way. I mean, that's been the approach for a long time. The workflow is meant to help us identify specific people who've been in contact with a confirmed case. And when you have that information, you can trace an infection back to a family member, a friend, or a coworker. Then what happens is the case will isolate for the duration of their infectious period, and any of the contacts that have been identified can quarantine. Now, it's actually a really powerful intervention that defines and breaks the transmission chains, and it can stop an outbreak while it can still be contained. You might recognize that we have a different situation on our hands now. Okay, so this is moving forward. So that traditional process is about identifying specific people, but recognize people move around. They go to the grocery store, they eat at restaurants, and they go to the movies. Unfortunately, in a pandemic, every public place really provides an opportunity for community transmission, and that's a situation where the source of the new infection can't really be traced to a known contact. With COVID-19, as you know, we've long ago crossed over from that human-to-human transmission to community transmission of the virus. And frankly, it's really not too surprising given our innate mobility as a society and our interconnectedness. It's pretty easy to imagine that a new case might become infected in a store or in a cafe or on a beach somewhere where you could be surrounded by people that you don't personally know. So in those cases, the traditional contact tracing process is just going to miss key potential exposures that come with community transmission. So community contact tracing is a term that we've coined to describe how location information can complement the contact tracing process by accounting not only for identifiable contacts, it's those people, but also the places in the community where people, cases have visited. So by including location in the contact tracing workflows, we can uncover, hopefully, new insights, right, about community transmission to see where new infections may be occurring. And that allows us to focus our investigations and take really targeted actions in the places that could be driving new infections. So I'll spend just a few minutes to cover the 3 major steps that are involved from collecting and managing data, and again, I know you guys love data, to performing the analytics and developing that insight that really helps with both the decision-making and evaluation of the process. So let me show you. This is the CDC's contact tracing form, and in the exposure information section, I blew that up a little bit for you on the right. It asks questions like, have you traveled domestically in the last 14 days? Location is addressed in the form. But if you were to answer, yes, I did travel domestically, the contact tracer would ask you what state you visited. Well, states are pretty large. They're big areas, and that level of location just isn't very useful. So let's make it better. We developed apps that can make gathering the location information much easier, as well as being able to conduct actually the rest of all of the contact tracing interview questions. So I thought I'd show you, people are doing this, right? The first one to really do this in a full-scale way was Tri-County Health Department in Colorado. And what they did was they used GIS to set up this dashboard that you're seeing. And under each of the white squares is a Survey 123 kind of application that does a piece of the contact tracing process. So they made it very easy for everybody to have all of their tools in one place and move the process forward. So this is an idea of what those data collection surveys look like. So they not only modernize what was previously a pen and paper kind of process, but it makes the collection of location information really easy when conducting interviews. So you can imagine somebody says, well, you know, I went to Walmart, and in the old days, if you wanted to get specific, you'd say, well, what is the address of that Walmart? We don't have to do that. You can say, oh yeah, Walmart on Main Street, and you can find that information pretty easily. So once those data are collected, we really want to be able to perform analysis, and that starts with the locations that we collected in the contact tracing interviews. And honestly, it doesn't matter if that information is collected in a spreadsheet or some other way, it can be put on a map. And that marks the beginning step of the spatial analysis. Now, the first analytic function, super simple, that you might want to perform is just density analysis, which is visualized here as a heat map, and actually it could provide some early clues about higher risk locations. In this case, this is sample data, but that is a nursing home, which has the darker hotspot. All right, well, moving on to more complex and cool kind of analysis, we can do link analysis. And that gives us a better understanding of the person-to-person connections that we're interested in. And we can use the tools from graph theory that help us to determine the strength of not only the person-to-person interactions, but also person-to-person-to-place connections, which again is where community contact tracing has power. And there are several ways to go even deeper with location to quickly provide additional evidence that could either support or refute a particular place as being higher risk. Now, one way that you could dive deeper is to pull in social mobility data. And we've got a lot of that available for you in the Living Atlas of the World. I'm guessing this group may be familiar with that. You could Google it. But the mobility data is right now a free resource that can tell you the current level of visitation for various points of interest across the country. And this is really important, right? Because once you know the high-risk places, you can take action. That action might mean more restrictions, right? Nobody wants to say it, but it could be more isolation. It could mean increased disinfecting procedures or simple risk communications to the public. Finally, we come back to dashboards as a way to evaluate and improve the contact tracing process. So by monitoring how we're doing, we can help with identifying and coaching contact tracers maybe that aren't able to keep up. Or we could determine we have to hire new contact tracers if the workload is the problem. Or maybe even identify other kinds of bottlenecks in the system which could impact the efficiency and the effectiveness of the overall process. Frankly, this is really important because the process needs to run at a pretty fast pace if it's actually going to stop the transmission of the virus. And of course, we can use the data captured to make more informed decisions that improve outcomes for everyone. Now, the next important example of mapping for community resilience that's very current right now is preparing for the efficient and equitable distribution of vaccines across the country and around the world. Now, there are some very complex and challenging issues in this whole effort that GIS could nicely support. Like, I've put them into 5 steps. I seem to be really big on 5-step processes. Identifying facilities that can store and administer the vaccines because they're different, right, with the candidates that are out there. Determining the concentrations of high priority populations. Where are those people? Because there's a phased approach to this and we need to find where the pockets of prioritized people live. Putting those 2 data sets together, you can start to expose gaps in access to vaccine for the larger population and formulate plans to reach everyone, people who may fall through the cracks, like putting together mobile outreach teams for people experiencing homelessness. GIS can also help to manage and monitor the vaccine administration and inventory system, keeping track of the PPE and the distribution kits for vaccine, as well as the actual doses of vaccine. And also GIS can be used to share progress on vaccination delivery across a community, because people are going to want to know what's going on, when is it their turn, where can I find a vaccination venue when it's my time to get that, the inoculation. So I will have a blog that is going to describe all of these different workflows in some detail. It's coming out tomorrow, so you can follow me on LinkedIn or Twitter, and I'll be posting there. All right, so for my next few examples, let me get this running. I'm going to go a little bit out on a limb. 3D mapping is not my personal area of expertise, but I thought that this group in particular would appreciate the use of some Earth observation data and 3D techniques. So in this case, we're looking at interpolated particulate matter pollution that's visualized as voxels in an area. The interpolation method that's being used in this case is 3D empirical Bayesian kriging. So you're able to visualize actually rather large amounts of continuous data here. Now, with regard to COVID-19, I wanted to see how this could really fit in. And I think these kinds of analyses could be really interesting for pre and post social distancing and quarantine impacts on pollution around the country. And I'll move to the next one. Okay, let me start this. So on this one, I'm a California girl, so I don't want to pass up on this temptation and opportunity to share this visualization and say, this one's totally tubular, man. It is 3D tubes that represent a 200-meter distance from traffic sources. So the color of the tube is really indicating the volume of traffic in an area. And I really think that this type of visualization could be interesting to compare folks with severe illness or death rates from COVID-19, since we know that those places where this traffic volume overlaps with residential areas, people are more likely to have asthma if they're exposed to significant motor vehicle pollutants. And those with asthma are more likely to have severe disease from COVID-19. So it could be interesting to look at it that way. Now, I really love this example that shows SafeGraph's social distancing data over 2 months in California during the stay-at-home orders. So this is May and June. So SafeGraph collects data from mobile phones and aggregates them, anonymizes them, so we can take a look at what people are doing. The vertical axis here is time, as you probably guessed. In blue, we have areas that had better social distancing behaviors than those in red. And the data here is really interesting, but I will say, what if we took this a step further? So using a similar kind of idea, I want to show you this. So here we're using a different company's social distancing data. This is Unicast, and they provided grades. This is still across California. Excuse me. So in red, you see it's an F, blue is an A grade, people keeping close to home. The layer you're seeing now in 3D is the date of the stay-at-home orders. Right underneath that, nobody was staying at home, nobody had to. And then March 19th, you see a lot of change in that behavior. Coastal counties seem to do better in California than the more inland counties where their social distancing grades were a little worse. So what can we do with this data? Well, one thing that was done is on April 25th, we started to see in California crowds at the beach. So what happened? What can we do with some good Earth observation data? Well, we pulled in the NOAA daily temperature data and created it as a voxel layer. So this is pretty cool because now you can see in 3D and over time how social distancing related to temperature. So particularly for San Bernardino County, where Esri headquarters is and where I used to live, you'll see that as the temperature got warmer in the darker brown, that social distancing got significantly worse. People just wanted to be outside. So we can use this kind of data to really understand behaviors and what's going on. So I just love that one. Okay, well, when we talk about resilience, we also need to think about organizational resilience. We've been talking a lot about communities and governments, but we know that businesses of all kinds have been particularly hard hit by COVID-19. Business leaders need to know the status of all of their facilities at a glance and be able to manage impacts on each one of them. They're going to want to keep track, or have been keeping track, of what is now a distributed workforce, as well as their employees who maybe were always working out in the field. They'll want to ensure the strength of their supply chain, maybe improve its geographic diversity so they don't end up being hung up on supplies. And they're going to want to also ensure their customer markets. They'll prioritize employee safety and wellness. And GIS can help with all of these things, as you can see with some of these tools here. But businesses also needed to be able to communicate with the public when their business is open or if it's closed again, and how their status is evolving. When employees do come back to the workplace, we're seeing a lot of them using indoor mapping to manage their indoor spaces, like rearranging workplaces for physical distancing and performing indoor and outdoor location tracking across their own campus to help identify where and with whom people were in contact should a new infection arise, and that way they could support those public health contact tracing efforts. So this crisis, as I've mentioned, is challenging and long-term, and it's not nearly over yet. So it really is up to all of us to try to keep public health concerns in balance with economic concerns. And I think that this recovery hub from Bozeman, Montana, has actually done a really great job of sharing the evolving business impacts, the tourism impacts, development activities, and COVID-19 case information with their population. They're keeping an eye on all of these key performance indicators so that they can keep adjusting their reopening phases to maintain that sense of balance. And so, I don't know about you, my voice is telling me I've talked a lot. I'm happy to answer questions, but I will say that if you want to look into any of these materials in more depth or detail, or explore just loads and loads of information, I really want to encourage you to take a look at the COVID-19 GIS Hub if you haven't already. There's hundreds of data sets available for you, as well as maps and applications and guidance, best practices, learning lessons. It goes on and on. So check it out, and thank you for your attention.
Thank you so much, Este. That was great. So much information to look at and appreciate. I want to get right into questions because we have some in the chat box. So Leslie is asking, do you think in general the best COVID apps have risen to the top by word of mouth, or is there an issue of competition between the apps and not necessarily the most trustworthy or the best becomes the most popular?
It's a really interesting question. So I think, the Johns Hopkins app clearly rose to the top, and there were other really great apps that didn't get the same airplay, right? Once they were sort of out in front, I think they maintained that status, but that's not to say that there weren't other really compelling apps like the one that I showed from the University of Virginia Biocomplexity Institute and a number of governments around the world. So it's true that some rose to the top and they simply got more media attention. But I will also say that in terms of reliability, that public-facing character of some of these apps, the fact that they were more popular, probably continued to enhance the quality of their data. I mean, I recall with the Hopkins data, they initially were showing city and county data, not initially, but in the early stages, they started showing that in about March. And they started to get some feedback from mayors or governors saying, hey, that case wasn't really in our jurisdiction, right? It became politicized. And so they said, okay, well, we're not going to show that anymore. But then we all worked together to try and help them to be able to provide that information because many thought it was critical. So they got really involved in some of their data decision processes because this data is messy. So I would say both happened. Some rose to the top, maybe unfairly. There are other great applications that are reliable out there, but being in the limelight does often improve the quality of the data as well.
Thank you very much. I know I have a question, but I want to see if anybody else on the line would like to unmute themselves and ask a question. Give you a chance to do that.
Hi, Megan. This is Dave Jones. Can you hear me?
I knew I could count on you, Dave. Go ahead.
Hi, Este. Great presentation. This is all terrific. I am the co-chair of the ESIP's Disaster Lifecycle Cluster, and we do a lot of work in GIS as well. And I'm just wondering if you have any use cases that you can discuss about people who have not trusted or believed in GIS, but once they see, what it can do, have become firm believers, right? Because there are a lot of people out there. You're talking about vaccines. I mean, this is all great data. Who knows how many people are gonna get the vaccine because they don't trust it, because we have this overflow of false information out there. But from a GIS standpoint, do you have any stories that you can talk about that can help give us more ammunition to talk to people about the value GIS delivers? Thanks.
Sure. Yeah, that's a great question. And I think there are a number of pretty good examples of that out there. And there was a slide that I showed towards the beginning where I talked about how a lot of times the efforts began with the GIS support team. So we're really talking about the people like you're mentioning that really understood the value of GIS, trying to offer their services to the people that they knew needed it, but maybe weren't aware or were reluctant, or were feeling like I'm too busy responding to do something new and different. And I've spoken several times about innovation during a crisis and why it's actually a good time to innovate. But in specific examples, so we saw that happen with San Bernardino County. This is the county that Esri headquarters lives in. And the GIS person there created a dashboard that had, cases. It was like the Hopkins dashboard, some basic information that gave situational awareness. And leadership got so inspired, they're like, oh, this is great. And so they started, if you look at their dashboard, just look up San Bernardino County COVID-19 Dashboard, and they started putting all these tabs across the bottom. So like, 12 different dashboards in one. And then they had to start building new dashboards because it was getting too full of information. So that was one place that was really interesting. And another two places that I'm aware of were at the state level. So in the state of Georgia and in the state of Missouri, they both have GIOs that are really capable people, but they have not previously been engaged with health departments. And so it took some convincing, right? That, hey, we're here, we're offering our services. And then as soon as they could make the connection and show quick value, which I think is my key message here, is you need to stand up something quickly that solves an immediate problem. Then people were all over it. And then they're like, now we're too busy, because people have increased their spatial thinking. They understand the utility. So we've seen that in a lot of different places, because I would tell you that health departments, by and large, have understood the value of mapping in more of a basic way, and maybe are using heavy analytics with desktop software, but maybe we're less familiar with some of the web-based applications, like creating surveys and dashboards and information hubs, because all of that seems a little bit counter to how we share health information. And so I think those concerns, and also just being busy public health people, maybe they haven't stayed up to date with the technology. So giving them a little insight into what can be done with stuff they already own is really helpful.
Thank you very much, Este, for that response, and Dave for the question. I apologize for cutting the conversation a little short, but I see we're near the top of the hour. So I want to thank you again, Este, for speaking today, and we definitely will follow up with you if there are additional questions. I want to mention to everyone that our next webinar in the Putting Data to Work webinar series will be on Thursday, October 8th at 3 p.m. Eastern Time. And it will feature Ed Kearns, the Chief Data Officer at the First Street Foundation, which is a nonprofit research and technology group working to expose flood risk data for the country. So with that, I'd like to say thank you again to everyone for attending, and say that I hope you have a nice rest of your day, and also mention that this webinar was recorded and it will be posted to YouTube, so we encourage you to go back and watch it again and share it with others. Thanks, everyone.
Hey, thank you.